My grandmother was diagnosed with progressive supranuclear palsy about 6 months ago at the age of 68, but the doctors do believe that she has been living with this disease for about 4 years. Last summer I went back home for the first time since she had been diagnosed. What I saw and experienced was difficult to witness. My grandmother was not the same person I knew growing up. Watching her not being able to stand for long periods of time, slurring her words, telling me of the hallucinations she experienced, made me more interested in learning as much as I could about this rare disease. PSP is known for its devastating effects and deterioration of its victims. Progressive supranuclear palsy is a very rare and devastating disease that affects people with no geographical, occupational, or racial preference. I have witnessed over the course of the last 4 years this disease deteriorating my grandmother's life, and I can tell you that it's not fun to watch. Today I would like to tell you what PSP is, the various symptoms of this disease, the progression of this disease, and the possible treatment options. PSP is a brain disease that has no cause, treatment, or known cure. It affects our basic common functions. PSP attacks the nerve cells that control walking, balance, mobility, vision, speech, and swallowing. Lori Barclay, a co-author of the Gale Encyclopedia of Medicine, explains that PSP progresses and will leave its victim's body unable to function. This disease begins slowly and continues to get worse, hence the progressive, and causes weakness by permanently damaging parts of the brain located above the nucleus that controls the eye movements, which is your supranuclear. According to Barclay, PSP most often occurs in individuals between the ages of 40 and 65. This disease will develop in 5 to 6 people per 100,000. It is slightly more common in men, and the disease is not inherited. The average life expectancy of a patient with PSP is 5 to 7 years. Now that I have defined PSP, I would like to tell you some of its symptoms. Symptoms of PSP can be in abundance, but almost all of them are present in all cases. Most patients start to lose their balance and coordination. Falling backwards, stumbling, and tripping become very common, as well as difficulty walking and immobility. According to the articles found on eMedicineHealth.com, most patients acquire speech difficulties. They start to slur their words, they have trouble comprehending what others say, and vice versa. Patients also start to weaken in certain movements. Their eye movement becomes weaker, and it is incredibly difficult to look downwards. They also have weakened movements of the mouth, tongue, and throat. This makes it difficult to swallow both solids and liquids. Another symptom is that of changes in personality. Patients often lose their interest in ordinary activities, and they can also act out with angry, aggressive, and sometimes violent outbursts. There's also a blank expression or glossy expression on their faces. Lastly, some patients may experience delusions or hallucinations. So once these symptoms are present and other diseases have been ruled out, the patient is diagnosed with PSP and this disease begins to progress. The progression of this disease is extremely severe. According to Patricia Lake and Mary Holman's compilation of symptoms, The Caregiver's Guide to the Phases and Stages of PSP, there are 4 phases. The first phase of PSP starts off mild. The first signs include the deterioration of handwriting, speech impairments, slurring words, falling, lack of coordination, vision problems, and the lack of desire to do anything. Once PSP takes a hold of normal body functions, immobility increases. Signs of phase 2 consist of problems sitting down and or getting up, increased difficulty walking, dressing, bathing, concentrating, and eating. At this point, most patients start to develop the severity of this disease. The third phase includes the progressiveness of all of the ones I've just mentioned. Signs of stage 3 include some obsessive-compulsive behavior, increased speech problems, difficulty reading, increased falls, in which afterwards the patient would have to sleep for an hour or so, and drooling. Finally, the last stage is the most devastating. The final phase consists of unintelligible speech, constant drooling, sleeping most of the time. The patient's body is completely rigid, experiencing delusions, hallucinations, and mild dementia. Like I mentioned before, the average life expectancy of a patient with PSP is 5 to 7 years. Now I have told you what PSP is, the symptoms of this disease, and its progression, so now I will describe some of the possible treatment options. Sadly, there is no cure for PSP, but there are a few treatments that can be used to help slow down its progression. Some scientists have suggested the use of levodopa, which is used for those with Parkinson's disease, but the effect is usually only temporary. Antidepressant medications such as Prozac has had some modest success. Non-drug treatment may be necessary for some patients. For example, weighted walking aids can be used to help the patient from falling backward. Bifocals can be prescribed for patients to help resolve the difficulty of looking down. Scientists and researchers of the National Institute of Neurological Disorders would suggest a gastrostomy. A gastrostomy is a surgical procedure that may be necessary when a patient is having a hard time swallowing food. This surgery involves the placement of a tube through the skin of the abdomen and into the stomach for feeding purposes. So in conclusion, today I have familiarized you with what PSP is, a variety of symptoms, the progression of this disease, and the different treatment options. Even though there is no cure, researchers, doctors, and scientists are studying to improve their knowledge and diagnosis of PSP. Luckily, the similarities between that of Parkinson's and Alzheimer's disease has led to a better understanding of this rare disease, and hopefully one day they can find a cure. Thank you.